Hello guys, this is Vamshi Krishna. Welcome to my YouTube channel. Today we will see some of the basic questions for upcoming staff nurse recruitment examinations. So the first question is, shrunken fontanellas are seen in the children. Options are dehydration, hydrocephalus, Down syndrome, Turner syndrome. The right option is dehydration. So in the case of dehydration, we can see shrunken fontanellas. The next one is, what is Apert syndrome? Options are premature closure of the coronal sutures, premature closure of the anterior suture, premature closure of the posterior suture, neurofibromatosis. The right one is a premature closure of the coronal sutures are also known as Apert syndrome. So it is characterized by deformities of skull, face, teeth and limbs. The next one is, what is the measurement of uterus? Options are 7.5 into 5 into 1.25 into 2.5 centimeters. Option B 7.5 into 1.25 into 5 centimeters. Option C 1.5 into 1.25 into 5 centimeters. Option D 7.5 into 5 into 1.0 centimeters. So the right one is option A 7.5 into 5 into 1.525 to 2.5 centimeters. This is length and this is width and this is the thickness of the uterus. The next one is, non-pregnant woman cervix looks like. Options are ear pinna and a tip of the nose, lip or tongue. The right one is the tip of the nose. So in the case of non-pregnant woman, the cervix looks like a, when we palpate the cervix, it looks like a tip of the nose. So in the case of pregnant woman, the cervix will be lip, looks like a lips. The next one is, what is the number of Graafian follicle in reproductive age? Options are 4 lakhs, 20 lakhs, 30 lakhs or 40 lakhs. The right one is the 4 lakhs. So 4 lakhs are the Graafian follicles are present in the age of reproductive. The next one is, the permanent stoppage of menstruation is known as amenorrhea, oligomenorrhea, dysmenorrhea, menopause. The right one is the menopause. So menopause is nothing but stoppage of menstruation. So it is commonly occurring after 45 years of age. The next one is, digoxin drug can be given for. So for whom we can give the digoxin drug? So what is the purpose of digoxin? Options are to dilate the pupil, to increase the intestinal motility. Intestinal motility is nothing but peristalsis. Option C myocardial contractibility. Option D reduce dysarrhythmias. Dysarrhythmia is nothing but abnormal contraction and relaxation of the heart. The right one is the option C. So option C is the myocardial contractibility for the used by the digoxin drug. So when we give the digoxin, the main purpose to improve the myocardial contractibility. The next one is, drug of choice in cholera disease. Options are metronidazole, tetracycline, ceftriaxone, and chloramphenicol. The right one is the tetracycline. Tetracycline is the drug of choice in the case of cholera disease. The next one is, drug of choice in breast cancer. Options are dabrafenib, tramitinib, and Darzalex and taxophene citrate. The right one is a taxophene citrate is a drug of choice in the case of breast cancer. The next one is, most common cause for death in children. What is the common cause in death children? Options are vomiting, diarrhea, dehydration, and bleeding. The right one is the dehydration. So dehydration is the most common death in children. So the dehydration can occur due to the vomiting and severe diarrhea. The next one is which of the following is the functional unit of breast? Options are ampulla, Acne cells, lactoferous duct, and nipple. The right one is Acne cells. So Acne cells are the functional unit of the breast. The next one is core body temperature can be obtained from. So where we can get the core body temperature? Options are rectum, tympanic membrane, right atrium, and all of this. The right one is the all of the above. Rectum and tympanic membrane and the right atrium are related to close structure of the blood vessels. So we can get the core temperature. So core temperature is nothing but the center inside temperature. So we can take the temperature, that is core body temperature, from the blood vessels related to the structures. These are the rectum and tympanic membrane and the right atrium are close related to the blood vessels. So we can get the core temperature. The next one is application of armpit fur, and it is a type of. So in this question we have the two questions, that is what is armpit and it is a type of. Options are handband for radiation, cool cloth under axilla for reduced temperature by conduction, heat by flaming, none of these. The right one is the option B. So armpit is nothing but keeping a cool cloth under the axilla, and the main purpose of the armpit to reduce the temperature by conduction method. So we have the two answers here. So we have the two questions and two answers. So the single option is having the two answers. The next one is hydrocele is a swelling of. So what is a hydrocele? Options are thyroid, scrotum, eye, breast. The right one is the scrotum. The scrotum has when the accumulation of fluid in the scrotal sac, it is called hydrocele. The next one is a part of sperm cell involved to penetrate in egg cell. So we have the sperm cell here. So which part of the sperm cell is responsible and involved to penetrate into the egg? Options are acrosome, midpiece, flagellum, and nucleus. The right one is acrosome. So acrosome is the first part we can see in the structure of the sperm. So here we have the acrosome. So this is involved to enter into the egg. The next one is which position is recommended for patient with the signs of shock? So when the patient having a sign of shock, so he is going to risk risk for risk for shock. So in which position we can recommend for the patient? Options are reverse Trendelenburg position, modified Trendelenburg position, Sims position, high Fowler's position. The right one is modified Trendelenburg position. So this position can given for the patient to reduce the reduce risk for shock. The next one is what is bladder diverticulum? Options are formation of a pouch-like structures, abnormal connection with other organs, opening of organ, and blood clots blockage. The right one is formation of pouch-like structure. So here we can see a bladder and it has a pouch-like structure. So these are called diverticulum. And same condition we can see in the intestine also. So it is called diverticulitis. When the infection occur for the diverticulum, it is called diverticulitis. The next one is the sequence of therapeutic nurse-patient relationship. Options are introductory, working, pre-interaction, and termination. Option B, pre-interaction, introductory, working, and termination. Option C, termination, introductory, working, and pre-interaction. Option D, any one. The right one is option B. The first phase is a pre-interaction phase, then introductory phase, and a working phase, and a termination phase. So, in the case of therapeutic nurse-patient relationship, the most important thing is the introductory phase. The next one is deep peroneal nerve damage can cause for. So, when the deep peroneal nerve damage occurs, what will happen? What is the complication? Options are knee bending, hand drop, foot drop, or sacral bending. The right one is foot drop. So, when the patient having the deep peroneal nerve damage, so he will have the foot drop. The next one is in which stage the signs and symptoms are appear in disease cycle. Okay, so in which stage of disease cycle the signs and symptoms are appear? Options are prodromal stage, incubation period, convalescence phase, and defecation phase. The right one is prodromal stage. So in the case of prodromal stage, we can see the signs and symptoms in disease cycle. The last question is tetanus is a type of vaccine. Option A, killed vaccine, live vaccine, and toxoid, or none of this. The right one is toxoid. So tetanus is a vaccine, a type of toxoids.